All right, guys, so welcome to the Finding Balance podcast. I'm your host, Dr. Adrian Mesa. Today's episode is going to be in Spanglish. I have a special guest here, Dr. Cesar Afaneh from Venezuela, from Caracas, no?
Yes. Caracas, Venezuela.
So he comes all the way from Caracas. He took a little trip to Europe, and then he joins me here in the podcast. I actually met Cesar over 10 years ago. He was just a med student.
Yeah.
And I think the last memory I have with Cesar is being at the pub in Brickell, where there used to be live bands that would play on Friday nights. That bar no longer exists. I don't know if you remember.
Yeah, I do.
But welcome, Cesar. Welcome.
Well, the last memory I have is when we were playing like flag football.
Oh, for real?
Yeah. With Diego and my cousin and Daniel.
Yeah.
So he broke his.
Oh, you were there?
Eyebrow. Yeah, I was there.
Oh, wow.
Yeah, I was there.
That was I don't know if that was Thanksgiving or. I know we just went out to go play football, but somehow or another, I was running with the ball and I threw an elbow and I hit Danny right in the face and I split his eye open.
His eyebrow was open.
And
I went to the emergency room.
We had to stop and get stitches. Oh, I forgot that you were there that day.
Yeah, I was there.
Oh, man.
Well, I think that was the last time we saw each other, man.
So catch me up a little bit on your life. Obviously, I follow you on Instagram. Actually, tell people what is your Instagram so in case they want to see it.
It's Cesar Plastic.
So, Cesar Plastic. If you follow him, you're going to see a lot of surgeries, lipo, breast augmentation.
Rhinoplasty.
You're going to see the man at work. So feel free to follow him. Actually, in the parking lot, just before we got up here, Cesar was just explaining to me that he doesn't only have patients in Venezuela, but he has a lot of patients that fly out of Miami, go to Venezuela, have surgery, and then later come back. Tell us a little bit about that.
Yeah, because, we have a system that allows us to receive patients from all over the world. Actually, they're almost all the time are Venezuelan people that lives outside and they go to Venezuela to get surgery. So they share with their family take care of the post-op and then they go back to the place we're living. But there are many patients that want a complete attention. So they can get surgery and stay in a hotel in Caracas with a nurse practitioner that's going to be all the time with them, taking care of the post-op and all that stuff. And then before the whole recovery, they come back to Miami or the country they're living. So we took a lot of patients from outside Venezuela too.
That's awesome.
Yeah.
How long have you been a surgeon so far?
5 years from now.
5 years.
Yeah.
What have
plastic surgery 5 years.
Yeah, as a plastic surgeon, 5 years. I guess
the thing is in Venezuela, it's complicated because all plastic surgeons have to be general surgeons first. That's a figure. So you have to make a degree in general surgery and then in plastic surgery. So it's about specialty is about 6 years when you finish the med school. So it's about 14 years of study.
Gotcha. Did you always know that you wanted to become a plastic surgeon?
Actually, I wanted to be a long time ago. I wanted to be an oncologist, surgeon. But then I discovered that plastic surgery gets a lot more than aesthetic. You can make breast reconstruction in breast cancer patients. You can make skin cancer surgery. You can make cleft palate surgery. So it's very interesting because there's a lot of procedures we can do to help people, not just in cosmetic procedures. You can do reconstructive surgery, and it's very interesting for it.
That's awesome. But let me plug my practice real fast. The host of this podcast is AMP Mental Health. Here, let me just go. This is AMP Mental Health. This is my practice. We're located here in Miami. We offer therapy and psychiatry across the lifespan. I have, like I was just telling Cesar, we have 6 psych nurse practitioners. Currently, we have 5 licensed mental health counselors. We have a couple of interns. We also offer training for students that are coming on board. But more importantly, we were also talking about the impacts of mental health on people that are going to have surgery, specifically people who are having, whether it's a breast augmentation or whether it's liposuction. These are life-changing surgeries, right? What is the screening like for somebody who wants to have these types of surgeries from a mental health perspective?
Well, I think mental health and plastic surgery are very close because I think a person that's gonna get a plastic surgery needs to have a clear expectancy of what they're gonna get.
Of course.
And but there are many people that it's like invaded from Latin America beauty standards that are so high. So it's very important the people to be healthy in a mental way, so they can get a surgery and they can accept their results as they're gonna be, because you can't be anybody else. So but the social media is invading all the time, and it's making people wanting to reach a very, very high standards of beauty. So that's hard for us to manage.
So do you find patients who have the surgery and they have unrealistic expectations, and
Of course, a lot.
they come back and they're like, no, you have to, I see a little something right here that you need to fix? Or
Yeah, some patients even they bring photographs to consultation, and they want I want to be like this. Sometimes it's impossible.
yeah, it's a
because
different facial structure.
Yeah, of course, facial structure or even bodies.
Yeah.
Because bodies in Latin America are beauty standards are very high. So you see models, you see a lot of publicity, like this. I don't know, the things you see in the highway. I forgot the name in English.
Oh, billboards.
Like, yeah. That's and announcements, and they're always selling you like a perfect body, perfect breasts, very, very marked abdomens, and the hourglass figure that not everybody can reach because of the anatomy. Anatomy is it's a very variable factor in patients. So you have to be very clear. I think even in my practice, I have to play, and I have to reach the mental health of patients to make them clear that they're gonna get a result that is personalized for them. But it's not always what they want, because they're not gonna be always the same as a model or as a beauty standard they're getting. So it's kind of hard to manage.
Yeah, that was my question. So what do you do, or I guess, what do you do with those patients? Like, how do you? They have these unrealistic expectations of this look they want to achieve, but then they can never get there, and they continue to come back to you because you are the man who is supposed to provide this for them.
Of course. Yeah, but well, I mean, in the consultation, you can explore in the clinical history all the aspects from the physical and mental health of the patient. But sometimes, if you see the patient having a wrong attitude, or they are like not getting what you're telling them, or very high expectations, sometimes I refer them to a mental health care provider. So it's better for them to go to therapy and accept them like they are, and then get plastic surgery, because there is people with this dysmorphic syndrome. So it's people that even when they look great, they look at the mirror and they never see what they want to be.
Yeah.
So it's very hard to manage. It's a
I see it here in the office with a lot of the young ladies that work here. Like, they come and they tell me, oh, what do you think about this? And I'm like, you're beautiful. I don't see what you're talking about. But they are insistent that there's something wrong with them. And I'm like, this is what you look like. Like, you can't change it.
Yeah. We have to fight that. I mean, the perfection doesn't exist.
It doesn't.
You have to reach the expectations and get close to it, but perfection doesn't exist, and nobody is similar to nobody. I mean, everybody is an individual, and it's unique. So we have to embrace that. And it's a very important work for you healthcare providers in mental health, that people can accept them, their bodies, their conditions, even when I don't agree with accepting diseases as normal. Okay, because we are in a world that it's a shame, but industry is always like selling us sickness lifestyle.
Of course.
So we have to be insistent in modifying the habits, in modifying the lifestyles to get mental health, to get physical health, and then comes plastic surgery.
Yeah.
If you want to make any aspect better that you can reach with the gym or the exercise, but it's very important to insist in lifestyle, because this is gonna maintain your results longer.
That's exactly what I was gonna ask you, especially for the patients who come in for a liposuction, right? They come in, you remove all of this fat from their body. You tuck the stomach, like they have this figure that they wanted, but it's the same contents of body fat, right, within them.
Yeah.
So then how? I almost wish, right? This isn't a perfect world. This doesn't exist.
Okay.
But I almost wish that we could have these people go through like a 6-month lifestyle change, and then have the surgery,
Of course.
and then continue that lifestyle change afterwards, because now they know what it takes to start to lose some of the fat. Their recovery is going to be so much faster because they've already become physically active. They're probably thinking about their nutrition more. They have more blood flow. And then they go back to that lifestyle change. Now this could last forever. Now the surgery is...
It's going to last much longer.
It's going to last so much
course.
longer. Because
Of course.
so many women I've seen have either a gastric bypass, or they have a liposuction, or they get on semaglutide. Now everybody's on peptides now,
Yeah, of course.
right? They see the results, but then it reverses. Why? Because there was no change. There was no lifestyle
There was no
change.
lifestyle change. Yeah.
Yeah.
If you don't change your lifestyle, even bariatric surgery like bypass or gastric sleeve, you can lose that surgery because people, the stomach it's a muscle that distends. And if you don't change your lifestyles, you don't control what you eat, you're going to gain weight anyway.
Yeah.
Even if you do any surgery. But with plastic surgery, it's complicated because you see a lot of patients that overweight or even in obesity, that we use the same patterns. It's a BMI.
Yeah.
So we take the BMI of the patient, and if a patient is over 27 in BMI, it's a patient that doesn't have to get plastic surgery. They have to modify the lifestyle. They have to make a gastric bypass or a sleeve, and then when they reach a weight that is near to the ideal weight, that's the moment for making the plastic surgery. Because plastic liposuction is not a surgery for losing weight. It's just a surgery for getting body contour, but it's not for losing weight. So that's very hard for us to make the patients understand that they're not going to lose weight. And some patients get angry because, well, if you extracted 5 liters of fat, why I'm not weighing 5 less kilograms? It's not.
Yeah.
It's not. It doesn't work that way. Because fat is lighter than water,
Yeah.
than muscle. So if I make a liposuction and take out 3 or 4 liters of fat, it doesn't mean the patient is losing 3 or 4 kilograms.
Of course.
So that's hard to make them understand. But well, there are patients that modify their lifestyles and they're happy because the results last very longer. Well, that's the idea.
What's the most difficult part about your job, about your profession?
Well, I think it's managing the fact that there's some people that they never look good. The dysmorphic syndrome, it's very, very, very hard to manage because there are patients that they come to your consultation every day and I don't look good, and like you said, objectively you see them and you see, well, you look good, you look gorgeous, you look beautiful. But it's never enough. Yeah, they're never satisfied. So that's a difficult part of it.
And you said you've been a surgeon for, I guess, a licensed practicing surgeon for 5 years now?
Yeah.
And what have you learned about yourself in those last 5 years?
Well, I have learned to improve my patience.
Okay.
Because I used to be a very impatient person. So with the practice and seeing patients and hearing about their lives, because sometimes patients come to your consultation not just to get surgery, but to talk to your doctor. And they are telling you that situations about life, and you become kind of a psychiatrist in the medical practice.
For sure.
So I have improved my patience a lot. Well, I really love my job, and of course, there's satisfying part of being a plastic surgeon because you change lives and make people feel better, and it goes positively in positive influence in the self-esteem, which I think it's a very important aspect of a human being.
Absolutely.
Yeah.
Because now if they had, like my girlfriend, she used to be mad about talking about this out loud, but now I could say it. She had a rhinoplasty when she was younger.
Okay.
And she was very embarrassed that she wouldn't want to talk about having a rhinoplasty. But then one day I said, but where does this shame come from that you don't want to tell people? Like, why is this a secret? And we talked about it for a while. And then finally she's like, you're right. I think that comes from like, my parents taught me not to say everything that goes on or things that you want to keep secret. And she's like, I'm proud that I got a rhinoplasty because I was unhappy with the way my nose was before.
Of course.
And I'm happy with the way it looks now.
Yeah. If you're happy with your result, I think there's no shame in people knowing it.
Yeah.
I mean, people is not making plastic surgery. They're making it for look better, but I think it doesn't have to be a taboo or something. It's just. Other thing is that you must not get obsessed with it. I mean, there's people that have a breast augmentation, then a rhinoplasty, then a liposuction. They don't take care of themselves. They get another liposuction, and that's you enter in a circle that you don't want to be, because results are not going to be better if you do a lot of surgeries of the same type. I mean, if you have a breast augmentation and you have to embrace it and accept your results. But sometimes people, I want bigger, I want rounded. It's complicated.
Yeah,
it's complicated.
Sure.
You have to be very careful in what you suggest your patients, for them not to fall in a constantly wanting change that maybe it's going to result in a unpleasant result or something.
Got you.
Yeah.
What would you say has been your biggest success to this point in your career?
Well, I think consistency. Yeah, of course. Consistency and I think it's very important to be clear.
I'm sorry. I said what do you view as your biggest success? Because you're saying consistency. Because how did you reach success? Is what you're saying?
Yeah.
Oh, okay. No. I'm asking like, what would you view as as I guess when you think about your career so far, something that really stands out to you as like, oh wow, I'm proud that I did that.
Well, I think the biggest success is having your patients happy with you. I mean, that's because they recommend other people and all that stuff,
sure.
and it's cool. It's cool. I work in Venezuela with the Cancer Society,
Okay.
and I had the opportunity to make a lot of breast reconstructions in cancer patients, and I think that's one of the biggest success, because those patients that maybe if they don't get reconstructive surgery, they tend to feel mutilated. So if you do reconstruction, they feel good, they are good, they are cancer free, and they are considered as survivors, but at the same time they are having like a quality lifestyle, and they are happy with their results because they doesn't feel mutilated. So it's kind of a great success when they feel happy about it.
That's awesome.
Yeah.
And I read on your Instagram profile that you're a maxillofacial reconstructive surgeon also.
Yeah.
Tell me a little bit about that, because that's very different from somebody who is doing liposuction and breast augmentation.
Yes, because the plastic surgery degree in Venezuela, it involves reconstructive, it involves a maxillofacial, it involves aesthetic surgery. But maxillofacial, it's oriented to the people that almost all the time have trauma. So we make facial fractures, orbital fractures, nose fractures, and mandible fractures, all that stuff. And it's kind of it's not the biggest percentage of patients, but you do that because, well, in Venezuela, it's a little messy, the things about traffic and all this stuff, a lot of motorcycles and all these accidents. Well, you are the surgeon. It's capable of fixing these fractures and all this stuff. It's cool.
It's
very cool.
funny. It's funny that we started the podcast talking about Danny getting elbowed in the forehead and splitting his eye open, because when I was 20, how old was I? I think it was after that. I must have been 21 years old.
Okay.
And I was playing flag football again, and I had a head-to-head collision, and I actually have a supraorbital fracture to my right orbit.
Okay.
And I had to I had to have reconstructive surgery from a maxillofacial surgeon.
Oh, cool.
Yeah. So I have 14 screws. You could probably see the screw here.
Oh, okay. Sí. Yeah.
So
I can see
un
it.
plato with 14 tornillos, which is crazy, right?
Yeah, of course.
So that's the type of surgery, because you mentioned orbital fracture repairs.
We do that too, yeah.
Wow, it's interesting. Yeah, because people see plastic surgeons as something very superficial sometimes.
Yes, and that's hard to manage too, because our colleagues and other specialties in medicine, they're
Yeah.
always talking about the plastic surgeon like, no, well, they are always aesthetic and making these procedures, and we do a lot more than that.
Yeah.
I mean, it's not just aesthetic surgery, it's reconstructive, it's cancer surgery,
Yeah.
and this is way bigger and way more complicated than just aesthetic.
Of course.
It's a very, very complete specialty.
Yeah,
Yeah.
and that's why, as you're sitting here talking, at first when you were gonna come on, I was thinking about you, and I was like, oh, cool, but plastic surgery, like he's doing boobs all day, he's doing liposuction all day. But now as you're talking, I'm like, oh wow, yeah. Imagine you're a cancer survivor, and you have a bilateral mastectomy,
Yeah.
and you're trying to recover. Now you're a cancer survivor, you have no breasts. How does that affect your life? How does that affect your sex life? How does it affect
Of
your
course.
self-esteem? How does it affect your outlook, your confidence when you walk into a room? And I've talked to women before who, after having breast surgery or breast augmentation, all of a sudden they say, I could wear a dress. I feel confident when I go to a party.
Of course.
Like, so it's literally life-changing for these
Of
people.
course. And it's satisfying because people recover their security and their self-esteem. For women, that's very important. Very important in all life aspects, like personal life, work life, sex life. It's very important to them to feel good with themselves. So it's very interesting, and it's a specialty that covers a lot more than most all the people think.
Yeah. Imagínate if my eye was drooped down, like my eyes were no
Yeah.
longer lined up. So imagine if I didn't go have reconstructive surgery, or maybe I went to a bad surgeon, right? And all of a sudden, my eye for the rest of my life is noticeably
Not aligned,
lower.
yeah.
It's not aligned. There's no symmetry in my face. It looks like something is wrong with me. Now I'm going to have problems with confidence, self-esteem. And again, obviously, I'll be able to live my life, and I'll find other successes. But it's definitely a major obstacle to overcome moving forward.
Of course, for everything. I think it's a physical aspect is vital
Yeah.
in every human being, and that's why besides making plastic surgery, we have to be life changers, like you do. Like in mental health, in physical health, it's very important for us to promote a healthy lifestyle, exercise as the
base, the
center, the
foundation, yeah.
base of everything, because more muscle, less sickness. It's very important to people to understand. So there's another branch too of the plastic surgery that is post-bariatric surgery. All the people that get a gastric bypass
Okay.
and gastric sleeve, and they lose a lot of weight.
And they have a bunch of hanging
We
skin.
call them the massive weight patients,
Okay.
massive weight loss patients.
Okay.
So they have a lot of skin hanging, and this comes with a loss of their self-esteem.
Mm-hmm.
So we do surgery for removing all this excess skin, and this is called post-bariatric surgery. And it is way complicated too, because these patients almost all the time have some vitamin deficiencies, low hemoglobin, so they are anemic or something because they because of the condition.
Yeah.
Because post-bariatric surgery gives the patient a lifetime condition, and they are going to be patients that doesn't manage nutrients the same way healthy people do. So
They become B12 deficient in
of course.
folate, and so
like folic acid, B6, vitamin, a lot of more stuff.
Yeah.
But we have to manage all that. So you became you have to integrate a lot of knowledge to do surgery on these patients and make them have a great recovery. And almost all the time, these are patients that are very happy because, well, I have 7 or 6 kilograms of skin hanging, and you take all that away and you gave them shape. So the patient gets motivated to maintain or to initiate a lifestyle that is healthier for them. So it's more than just aesthetic. We are life changers. We all people that do health, and even any of their branches, we are life changers.
Yeah, it's funny because again, before you came in, and I'm sure you get this a lot. Most people think of plastic surgery in a much more superficial way.
Yeah.
And just hearing you talk, once you start talking about cancer survivors, now you're talking about somebody post-bariatric surgery. Again, something that it's noticeable. I've seen people at the beach where they have all this hanging skin.
Yeah.
And I could imagine that's, again, it goes back to self-esteem, and it goes back to just their outlook on life. And everybody goes to the beach, they take off their shirt, and then now they're uncomfortable. So that's cool. It's good to see it beyond the superficial.
Of course,
I guess what I'm getting at.
Or sometimes you talk to people and like people you're knowing, or even in medical meetings, and people that are not practitioners, but they think that you only do breast augmentation or liposuction. That's all you do. No, it's not like that. I mean, we do a lot of more things that help people in very, very, very other ways. So it is a very, very complete specialty, and it takes a lot to be here.
That's awesome.
Yeah.
Yeah, I think that's something else. Well, before I get into that, what is you've done volunteer work, no?
Yeah, of
You were
course.
working with an organization. What kind of volunteer work were you doing?
Well, in Venezuela we have a Operation Smile that is
Okay.
international,
Yeah.
but in Venezuela we have a chapter of Operation Smile, and they do like 2 or 3 journeys a year, and we do cleft palate surgery for kids. Always, it's patients under 3 or 4 years old. And this is helpful because you're not only doing aesthetic surgery for correcting the cleft palate, so you're making functional surgery, because the communication between the palate and the nose cavity gives a lot of problem to these patients. So you correct that, and you're doing reconstructive and aesthetic surgery at the same time. So this is a foundation that's been working in Venezuela for about 30 years. I've been there, I think, 3 or 4 journeys from now. And we also have a foundation for skin cancer, where we help almost all the time. There's major adults or people over 60 or 65 years that have skin cancer, but they have no resources to get surgery. So we do some, I think, around 15 or maybe 18 patients monthly with skin cancer. Well, we help them, and it's satisfying for us because it's volunteering, and we're helping society. Because if you make a primary detection of the skin cancer in early stages, and you correct it by surgery, you're preventing all the complications about it, like metastasis and all the stuff that's coming over then, and it's gonna be more complicated for the patients and for their family too, because we're in Venezuela, and even now that things are a little bit better, I mean, in the economically talking, but we still have a lot of social issues. So
Gotcha.
it's very important for us to help.
Got you.
Yeah.
And has that created any barriers in terms of obtaining supplies or anything like that when you're doing surgery? Just the I guess the economic state of the country, has that affected your ability to practice at all?
Well, we had a crisis between 2015 and 2019 where we were having some difficulties in importing medical supplies.
Okay.
So, well, those years were tough. But right now, we have
Everything's
everything.
good.
Yeah, everything is nice. It's cool.
And I owe you a visit to Caracas. I've been telling you
Yeah,
for a
man.
while, for probably the past year, that I was gonna go visit you, and I need to go.
Yeah.
I definitely need to go.
You will have a very, very good time. I mean, we live a lot of realities at the same time. Okay, not everything is good, but Venezuela, it's a country that even when we have all these economic and political problems, I think it's a beautiful, beautiful country. I mean, we have good people. We have Latin people.
Yeah, no, and there's a ton of Venezuelans here, and honestly,
a lot.
there's not one Venezuelan person I know that I dislike.
Yeah.
So I'm ready to go visit Caracas for sure.
Anytime you want, bro.
What has been, so through this whole journey, you went through medical school, you went through residency, training for your specialty. What has been the biggest obstacle that you faced along the way, either personally, professionally?
Well, the biggest obstacle in professionally talking, it's that sometimes you know what you have to do to help a person or a patient, but sometimes you don't have the resources. So it's kind of frustrating when you know that you have to do something for a patient, but you don't have the resources to do it, and embrace the fact that even when you have the knowledge, you can't do everything to save the patient or to give them the best attention. That's kind of frustrating, but it happened a lot of times. I can say it didn't happen because it happened, but well, it's something you can't solve by yourself, because sometimes in public hospitals in Venezuela, situations tends to be complicated, and I'm not blaming the hospital by itself, but the same economical situation, all that stuffs make that sometimes resources get other ways that have to be, so it's kind of complicated.
Gotcha.
Yeah, it's a professionally talking, no? And personally, I think that it have to a lot of relation with the mental health, that the medical training in specialties and degrees, it's very, the treat you receive from your superiors and the resident of higher years, it's very, very tough. You enter to the hospital as a resident in any specialty, like surgery, because what was my first degree, and all the people is always treating you so bad, and it's like a military academy. It's always like they're trying to humiliate you, and this is
why is that part of the so that same culture exists here?
Yeah, of
why
course,
in the medical field? Why do you think that culture exists? Because it's not conducive to learning. Like, you don't learn better because people are treating you like shit.
No, of course not.
Right?
Of course not. But they treat you like shit. I mean, it's if you enter as a first year resident, and even when you have the knowledge, because you're coming from a med school and you know what you have to do, but you don't have the practice because that's why you're there.
Yeah.
So they're always like treating you like you have to already know everything you have to do, and if you don't do it, they're like you are a piece of crap.
Yeah.
And that that bad treat all the time, it's always like annoying you. So you have to be very strong in character to advance with it. I thought of quitting a lot of times.
Por eso.
No
entiendo. Again, it's not conducive to learning. It's not going to help the person who is in training do any better. They're not going to perform better because you're putting more pressure on them. In fact, they're probably going to make more mistakes.
Of course.
Because of the level of stress that you're placing on them.
Yeah. But I don't know. It's kind of it's had always been like that, and people just learn to treat you bad from the beginning. So when you're advancing.
So now my question to you is this: when you were in a position of power, do you feel like you began to engage in the same treatment towards the new people?
Well, I proudly can say that when I was a chief resident, I didn't treat my residents bad.
Yeah.
You have to develop a strong character, because you have pressures all the time, not just from the residents, but for the work to be done.
Yeah.
And the specialists that are always supervising you, and they're the ones that are gonna put your grades. So you need to have good grades, and because I was formed as a surgeon in the Central University in Venezuela, and the evaluations in Venezuela are from 0 to 20.
Okay.
But the minimal improvement grade is 15. So if you're under 15, you're not getting the university degree. So you have to be very consistent on all the work to be done. And that's why you have to reach a strong character. But it doesn't mean it's different to have a strong character and to treat people bad. There's a difference between. I think, I don't know if my residents are hearing me right now, but I can probably say that I never treat them bad. Just we're always guiding them to make things better. But I think if we all change in the new generations, we can make a better and a healthier workplace.
I agree.
For everybody. Yeah,
I think
it's hard to manage.
It's even the same for me here as being the boss here at work. I'm still not used to it, right? Because I'm in charge. But when you have employees working under you, it's important for them to respect you, but their respect doesn't mean that they have to fear you.
Of course.
Because they're not going to perform any better if they're just scared. Is the boss coming around? It's more so I show them love, I show them respect, but I also set standards. And it's as long as you're meeting that standard, we're good, because we are all trying to work together to just move the company forward, to make sure patients are getting taken care of, to make sure that that the company is functioning and thriving.
Of course.
And if we're not doing that, then that's where we run into issues, right?
Yeah.
But it doesn't mean that you have to just hammer them down and
No. I mean, things doesn't work better because you treat people bad. That's something we all have to understand. And the same for me. Right now in Venezuela, I have two small clinics, one in Caracas and one in Barquisimeto. That's my place of birth. And but I think the same way you're doing. I mean, I think you have to set standards, but you have to treat people with love and respect.
Yeah.
And I think you have to work when you're a boss or when you're managing something that you have to be like a stair for the people to go up.
Yeah.
And impose them to be better. And even if they someday they left the work or they quit working with you, it's because of you they found better opportunities to be better, to grow.
I agree.
I think that's very important for all.
Yeah, I agree. You went through so much school, right? And you just said you have two clinics. Did medical school prepare you to be an entrepreneur?
Not at all, man. I've been hitting a lot of times.
I love this topic because I talk to so
yes.
many people who are in healthcare who
we don't have idea about finance.
Zero, right?
No.
Zero.
We never reach financial education. So you have to be ass kicked a lot of time to learn. Yeah, it's very hard.
So how did you navigate that? So you said you have two clinics. Congratulations,
Yeah,
right?
thank you, man.
How big is your staff right now?
Well, I have around 10 employees.
Yeah, 10 employees.
Yeah.
You probably have assistants that work with you.
Yeah, of course.
You take in residents also to help?
Well, not residents, but I'm about to open a fellow in a fellow training in plastic surgery. But right now, sometimes I have medical students going to my operating room and they see surgeries and all this stuff. Yeah. But
so how were you able to navigate that transitioning from just the medical mindset and being a plastic surgeon, being an employee, maybe working somewhere, to all of a sudden saying, I can do this?
Well, I think life is about taking risks. So when I graduated as a plastic surgeon, I was working in many clinics, operating, and then I told myself, well, I want my own operating room because, I'm working for everybody else and everybody else is taking my money. So yeah. I want to make my own stuff. And it was kind of rough because at the first time, nobody tells you what to do. So you make a plan. But in Venezuela, I think it's a little more complicated than here because financial situation, you don't get credits. You have to do all like instant cash payments for everything. So I work a lot. I remember in 2019 we were making the clinic in Caracas. Mm-hmm. So I was with a partner of mine that is my associate. Mm-hmm. And he's a plastic surgeon too from República Dominicana, Dominican Republic. Yeah. And we were like planifying, well, how much you have? Well, I'm going to sell my car and we'll get some money to start. And we started the project. And then in 2 weeks, we had nothing. So this is crazy because we started building the surgical room and getting the permissions and all this stuff. And then
you ran out of money.
We ran out. So we started working, making promotions, operating a lot. And every weekend and on Fridays, we were, all the money we did.
Back into the business.
Yeah. So I think it's kind of, you have to get a little bit of luck, but you have to be consistent. You have to do things good, of course. And planifying that if you have an objective, well, you have to reach it through a good way. So it's work a lot. That's all I've done these 5 years. But I think have reached my goals. And of course, I'm only at 10% that I want to do. It's maybe I would like to have a clinic here in Miami too.
Hey, so, it can happen, man. Why not?
Yeah,
Why not?
Of course.
So what?
I'm working on it.
So you've been a surgeon for 5 years. You have 2 clinics. You have employees working under you. You're starting a fellowship. When you lay your head down on the pillow at night and you're just thinking about the things you've accomplished, would you call yourself successful?
Yes, I do.
Okay.
I do. I'm very proud of everything I've done.
No, but being proud is one thing.
Yeah,
but-
I'm proud and I think I'm successful. Yeah.
Okay.
Of course. Yeah. No, I have no issues on it.
Yeah.
But I think even when I'm successful, I think that I can be more successful. So that's what I was telling you. That I'm right now
You're at
maybe
10%.
at a 10 or 15% of everything I want to reach.
Okay.
But this has been a hard way because what we're telling each other, it's I don't know if you did had it, but we don't have financial education in med school.
No.
Not at all.
We-
So nobody teach you how to capitalize your career.
There is
And-
not one class in any schooling that I had that was about entrepreneurship,
No.
how to manage finances, how to do billing. Because in the United States, this is all insurance driven. How to manage an insurance driven medical business. None of that was ever taught to me or any of my colleagues. I taught one course in the University of Miami when I was a professor, which was called professionalism, but it was only one lecture that I gave. And it was just about, it was trying to do exactly what we're saying, teach the students about how this thing works. And all the students would just leave like, wow. I talked to them about negotiating contracts, what things to avoid in contracts, like non-compete clauses. I taught them about the third-party payment system, things to be aware of, Medicare fraud, like any sort of fraud to avoid. I showed them clips from news of doctors being arrested because they were just conducting themselves in a fraudulent way. So those classes don't exist. And that course should exist because students that are in the medical field, whether you're a physical therapist, an occupational therapist, a surgeon, a medical doctor, a nurse practitioner, whatever you are,
You're gonna live of it.
yeah, you're gonna live off it. You're gonna be a part of the system, but it's almost like they don't want you to create your own system.
Yeah.
And that's what I want to do. I want to show people, if I did this, a kid from Hialeah who went through school, had no educational background from an entrepreneurship standpoint, I want to teach people you could do it too.
Yeah, of course.
And it's so cool to hear that somebody like yourself from Venezuela with a similar story. You go through medical school, you go through training.
Actually, I didn't grow up in Caracas. I grew up in a very small town called San Carlos.
Uh-huh.
Everybody that knows me knows me from there. I went to Caracas in 2014 because I entered in the general surgery degree. And well, I stand in Caracas and I achieved a lot of objectives in there. But I mean, if you want it, you can manage it, but it takes effort, it takes consistency, and it takes you're gonna fail a lot of times. But I think it's that you get up from these fails and continue the road, because a lot of people give up. A lot of people sees that, well, it didn't work, I give up and I'm not gonna still trying. And I think that trying a lot of more times gives you the success for it, because, well, like I told you, I didn't receive any financial education, so I have to learn from myself. But in that way of learning, you receive a lot of punches in the face. So sometimes you fail. Sometimes there's people that scam you.
Yep.
A lot.
How many times have you failed along the way, would you say?
I don't know. I lost the
A lot, right?
yeah, of course.
How many times have you wanted to quit along the way?
A lot of times too.
Yeah.
And
I think that's the part that people miss. And I think we should also, in the education system, we have to teach people that failing is okay. I'm sure.
Of course it is.
But the problem is in in every educational system around the world, it's like you said, you have a 20-point scoring system. Anything below a 15, you're out. You're done.
Yeah.
Life is not like that.
No.
Life, I can approach a situation and score a 0 and still learn from it and still come back and win.
Yes. Totally.
So people feel like once they fail, they're done.
They're done. Their life is over. And it's not like that.
And it's not like that.
It's not like that at all, man. Yeah, I think it's we have to be like, I like to be an inspiration for people in med school, like I was 10 or 12 years ago, that I was just a kid finishing med school and didn't know what to do. I think I went to a tough crisis in Venezuela that was those years that were very hard and all the political and economical problems, but we got over it. And I think the important thing about it is you can manage to do the projects you want to do without damaging someone else, of course, but consistency is the key. all the time. You have to fail, you have to try it again, you have to fail, you have to try it again. But if your objectives are clear, nobody have to take you out from there. I mean, it's satisfying at this point, but you went through a lot of shit in the way. So
How many people along the way, I guess, did you feel weren't really encouraging you? Did you feel along the way that people were just kind of saying, hey, like, I don't think you're going to make it? Or do you feel like you just had a lot of support along the way?
Well, I had people that supported me, but about almost all the people, even in the crisis, because I started my projects at the last year of plastic surgery school. That was in 2018. When I don't used to talk a lot about my projects with people until they're already done, because I don't like people to know what I'm doing.
That's funny. Okay.
Because it's kind of, it's kind of funny that when you want to do something and you tell people that you're going to do anything, it's more the negative comments you receive than the positive ones. So there's a lot of people telling you like, oh, are you sure? Are you sure you're going to manage it? Or just you're going to do it? And that's what, of course, I'm doing it because I wanted to do it.
Yeah.
Because I'm going to reach my goal. But, I used to talk when I'm almost done. I did this. Yeah.
I did this.
It's already done.
All you can tell me is congratulations.
Yeah, of
at
course.
This point.
All you can say is, you did it, man.
Yeah, good job. Good job.
Yeah, of course.
It's funny. So there's two different mentalities. One is your mentality, because I've heard one is your mentality of move in silence. Don't say what you're going to do. Just let your actions speak. Another one is, which I often do, I'm guilty of this one, is say out loud what you're going to do. People are going to give you those negative comments, but do it anyways.
Yeah, of course. It works too.
And I think both of those are excellent. Why? Because there's action involved in both. The part that I don't like is whether you stay quiet or say you're going to do something, but do nothing.
Yeah.
So no matter what, action needs to be present.
Of course.
So above everything, whatever you're going to do, you could scream it from the rooftops or you could stay quiet about it, but make sure that you're just doing something.
Yeah.
That's what I want people
and
to
achieve
do.
your goals.
And achieve your goals. Yeah. Pursue something. Go after something. Give yourself some sense of purpose that you're chasing something.
Yeah.
So it's cool because you said that now you're moving into, I guess, building a fellowship within your practice. You've built 2 practices and you're at 15%.
Yeah.
Because some people might look at you and say, oh, you're done. What do you mean? You're set. Cesar, like, what are you going to do?
I mean, if you can go for more, you have to go for more, because youth is not going to last forever. So I picture me in I don't know, 15, maybe 20 years. And when you work at something like me, that your hands are all the productive tools in your work, you have to think in the future, because I'm not going to be able to do surgeries forever. I mean, I'm going to lose range of movement. I'm going to suffer from back pain maybe.
Yeah.
And I try to keep my physical health optimal, but aging is something you can't avoid. Yeah. I mean, we are all going to age. We can manage to age better, but we're going to age anyway. So the thing is, it's very important to all of us to think in a retirement plan where you can live from what you've done in the last years of your life. So if I work hard for 15, maybe 20 years and I build an empire, that empire is going to give me the tools for them to live without being concerned about economical situation and all that stuff. And I think it's very important. But you learn that when you realize you have nothing and you want to build it from zero. And I think the same as you, because you have achieved all this, that what I congratulate you a lot, man, because this is very beautiful. I'm very proud of it. And when you're on zero, like you told me, and you begin to grow, you just learn to appreciate what life has given you. You appreciate your body too, and you begin to take care of it. And of course, to help your family on all this, but you learn that everything is possible through effort and consistency and being like waking up from every fall. So this is I think you can consider that like a success. Yeah.
So because you keep saying consistency.
Yeah.
do you feel that is just because I agree with you, and I feel like if there's anything that if there's any one recipe or one ingredient that people need to achieve anything, it is consistency.
Of course. And patience too.
And patience, yeah. Well, consistency involves over long periods of time,
course,
so you have to be patient.
Yeah.
But I feel that we're living in a time where people they want it quick. So, for instance, and this goes back to surgery. Sometimes people want that quick fix without realizing, hey, if you want this to be sustainable, then you need to do something besides this and be consistent at it over time. And so I think that's the biggest part where people become concerned when we talk about plaques, or where people begin to place judgment, is that these quick fixes they're good, but are they sustainable? And I think that's the part where people are I think that's where the judgment comes.
Of course.
And I'm not saying, hey, who gives a shit, honestly. If people want to judge, they're going to judge. But if we want these things to really last, then we have to show people that consistency and that hard work is what's going to drive them towards those goals.
Of course, but that applies for everything in life.
Exactly.
Not just for business.
Yeah.
I mean, it applies for your physical health, for everything you're doing. I mean, it's sometimes people just see the top of the iceberg, but they don't see all the effort that other people have put it in to be like what are they right now.
Yeah.
So and I think it's kind of this accelerated world we're living right now because of the social media and all this stuff that I think it's very useful to have social media, but we have to be very careful in what we believe and in what we want to follow, because there's a lot of people that like selling these life-changing courses, and you're gonna be rich, or you're gonna achieve your goals, and you're gonna have a physical form like Thor in 2 weeks or 3 weeks. That's impossible. Man.
Yeah.
It's impossible, and people have to understand that it's impossible to have big changes in a short period of time. I mean, everything is about being like all the time having the objective clear, but working for it. And working for it involves a lot of time. It's not something you're getting from zero in 1 or 2 weeks.
Yeah, like some people might see your success and say, oh, he has 2 offices. Oh, he's set.
A lot.
And it's like, Cesar, how many hours did you spend in the library?
Uncountable. Yeah,
right?
Of course.
How many hours of training do you have in a surgical setting?
Yes.
How many times have you put on scrubs? How many 12+ hour days have you had? But a lot of times people don't want that.
How many turns in the emergency room? Because sometimes we work about 48 hours continuously without having an hour of sleep. It's crazy, man.
Yeah.
It's crazy.
So that's the part where people need to realize, and I'm not talking about just the medical field, I'm talking about any aspect of life.
Yeah.
The work has to be it. The work has to be present. Like you have to do the repetitions over and over and over. And you're going to fail over and over and over.
Yes.
And you still have to get up and be consistent over and over and over. But people don't want that.
Yeah.
And I hope they do. If I'm talking nonsense and you really want it, then go get it. But I just feel that there's so many people who want this quick fix, the instant gratification, the remedy, the secret pill, the silver bullet, whatever you want to call it. They just want that thing. And I'm listening to Cesar here across from me, and it's just a reminder that it's not like that.
No, it's not like that. I mean, miracle solutions. I don't believe in that. I mean, it's anything that fixes your life in a shake of your fingers.
Yeah.
It doesn't exist, because everything have to be like it's a stair. You have to begin to go on, and you're gonna fall, and you're gonna go on, and you have a price on the top. But sometimes it takes a lot of time to reach it. So I can tell people that there's nothing miracle. There's not a miracle that it's going to solve your life in an instant. Well, except for the people that is very lucky that they win a lottery or something. But it's a minimum amount of people in the world. And sometimes
they lose
it's not going to guarantee you the success or to you to manage good that money, because it's not. I think it's not the money. I think it's what you do with it.
Of course.
And how you manage it. And I think everybody in some point have to explore the possibility of I don't know, make a lot of ways to make money in each one. So in that moment, you become an entrepreneur because you have a lot of, a lot of places or a lot of business that are giving you rewards. And well, if this one goes bad, this one goes good, and you're always receiving from this certifying funds of funds you're receiving from every business.
Yeah,
So,
you're talking about different streams of revenue.
yeah, of
Yeah.
course.
You said earlier that you're at like 10 to 15% of the level you want to achieve.
Yeah.
Let's just say you're at that 100%, and you were just mentioning it's what you do with your money. What at that point, what do you think you're gonna do?
Well, I'm right now doing a lot of financial education. Reading a lot about it because I think we're entering in a moment in the world that is very, very messy in the money ways. I'm a believer that the world from here to 2030 we're gonna have no cash. We are gonna have a new way to manage our investments and all that stuff. I think at this point, you see, we had a crisis in Venezuela where the Bolivar, that our coin, our official coin, lose a value from around 3 million% or something like that.
What? So
Yeah.
it's nothing. It
Nothing.
became nothing.
I mean, it's if you had $1 million in Venezuela in 2012, you'll have $3 or $4 by now. What? Yeah, it's crazy. It's crazy. If you save, so a lot of people make their savements in bolivares, so they don't have anything right now. So
Oh
I
my
think
God.
we have to.
Bitcoin hit 50K last night, people. Just letting you know, Bitcoin is it's volatile, but it's
I
there.
like cryptocurrencies investment. I've been a little into it, but I think we have to have many ways of savings and be smart. We have to have a suitcase and a diversified suitcase where you invest. Maybe you have your dollars in cash. You have your dollars in the bank account. You have some cryptocurrencies. Even I've been learning about this investment in actions like Apple, Tesla, and all this
like
stuff.
stocks, yeah. Huh?
Yeah, and I'm doing a broker investment monthly. So sometimes we don't think it, but if you organize yourself to spend less in things that you don't need, and you save this money, even if it's $5 or $10 monthly, it doesn't matter. But if you don't eat that hamburger you want to eat it in McDonald's that day, and you save that money and you invest it in I don't know, in Bitcoin and in a third option in any
in any investment,
yeah. I think you can see the price maybe in some years. So it's very important to us to know that there are many ways to ensure your future by thinking and investing in a smart way.
You're right, because we were talking about hard work and consistency, but it's also how do you manage your money after that hard work and consistency pays off? How do I diversify my portfolio to make sure in the future that I still have something?
Yes, it's very important. Yeah.
And that's something, again, in the education system, they never taught us, at least here in the United States. They don't teach you that.
No, not in Venezuela either.
Why though?
I don't know.
So why?
Man, I don't
if
know.
these are things that drive our future, they dictate our retirement. Why is nobody teaching about financial literacy or financial education? Why is nobody teaching entrepreneurship?
Because the same reason you said a few minutes ago, the system just wants to get you into them. But almost all the time, they don't want you to grow over them or at the same level. So it's kind of hard.
But there's so many people who are successful. There's so many people who are successful. There's so many people who are entrepreneurs who are doing well. How come those people aren't invading academia to say, hey, or maybe they're just not letting them in to say, hey guys, like we need to teach this. Like this is important for our kids' future. Why aren't they allowing that?
Well, but if you take percentage of these people, it's a very small amount of population.
Yeah.
I mean, it's very small.
But those small people
insignificant.
change the world.
Of course.
Because it's the entrepreneurs who change the world. Look, Apple was founded by one guy, you know?
Yeah.
Steve Jobs is one guy.
Yeah.
So these are that small percentage of people that can change millions of lives, but then academia is still doing its own thing.
Yeah. I don't know why. I don't know why. I'm a true believer that every university in the world should have something to teach financial education.
I agree.
That's crazy, man. And you see a lot of people that's just invaded by the system, and they live like that all the time, and they never achieve something more than having a regular life and bills to pay, and it's complicated. That's another topic.
Yeah, no, for sure. Sorry, we went off on a tangent. You started talking about diversifying your portfolio.
No, it's cool. But I agree with you a lot, man. I think it's an essential part of our lives to have financial education. And for me, it started when I finished my med school. I started to learn about investments and business just when I finished my med school, because I didn't learn that from the university. I just was reading. I had a lot of scams too, because, I remember in 2018, I started with this cryptocurrencies investments, and there was a trader that came to, no, we can trade, you invest this and I'm gonna give you this back. I was like, oh, okay. Unfortunately, I just invest a little amount of money, but wow,
it ended up being a scam.
It was a scam. Yeah, I didn't get my money back. I didn't get any guarantee. It was a mess. But well, it's part of learning. That
And you learn,
fail sometime.
yeah. A veces que tienes que pagar, ¿no?
Yes, totally.
Is there anything that I'm just trying to think if there's anything. I have you here. You were going back to Venezuela. I need to ask important questions while you're here, right?
Yeah, of course, man.
So I guess what advice or what has been your biggest failure along the way? So you've learned so much, you've gained so much. What's been the biggest failure that you learned from that you turned around and said, okay, like, if there's been any, I don't know.
Well, no, I got a lot of failures, but I mean, I think this is more personal than financially or professional. But I think I wasn't in a part of my life around 10 years ago that I wasn't very, very well in any parts of my life, like economically or academically. I was studying, but I wasn't like very happy with what I was doing. And I used sometimes to blame my familiar situation in that time, because, well, it was complicated. My dad left the country. My dad doesn't live in Venezuela right now. My sister lived too. And I was kind of sad because all the family split it in different, for different reasons that I understand now, but I wasn't mature enough at that time to know that was something that had happened. So sometimes you used to blame your environment for the things you're doing right now. So I think that's a big failure when you reach that situation, because if you blame the other people about the things you're doing right now, it's because you're trying to justify your failures, but in a way that doesn't work. So I remember that was around 10 years ago, and I was like very frustrated with everything, and like I don't know, it was I was kind of depressed too.
How did you break out of that?
Well, I got therapy.
I was actually going to ask you.
I got therapy. Good. Yeah. So it's
how did therapy help you? How did you sift through that?
Well, I don't know. I did some exercises about putting on a balance what good things I had in life, what was the bad things, and all that stuff, and I learned, and gives me the maturity to know that you are the only responsible of your life and of what you do. And any failure or any success is just your responsibility. You have to be related to people who is successful and who you can learn from. And that's very important. But it's your responsibility only, and it's like you can blame your parents, you can blame your family situation, even you can blame the economical situation of a country, because in Venezuela that happened a lot. A lot of people got frustrated because the economy went down.
Sí, lo
and
perdí todo.
I lost everything. Well, you have to start again and go on, because there are no guarantees. I mean, I'm having a good time now, but there's no guarantees that this time is going to last forever. So we have to be reinventing and evolving all the time with the world, because it's part of life.
I think that's something that I've learned myself, is just saying, no matter what happens, like you said, whether it's good, whether it's bad, it's on me.
Of course.
If something really bad happens, it's my fault. If something really good happens, it's my fault.
Yeah.
It's my responsibility, whether it's good or bad. And that way, if I keep on blaming the world around me on my environment, then that means that I have zero control in my life. And the environment is dictating my life.
It's dictating what you're going to do.
And that is a powerless place to be. And if I believe, no, you know what, this is up to me. Oh, the economy goes to shit and I have no more money. It's up to me to bring myself up. I can't expect for the government to step in and help me and save me.
Because it's not going to happen.
Yeah, exactly. If my girlfriend leaves me and she leaves me by myself, okay, it's on me to pick myself up. And it's probably my fault that something happened there. And that way, at least I could say, oh, what's my responsibility in this? And how can I improve the situation? And what can I learn from it? Because if I just say, oh, it was her, or it was him, or it was the economy,
you're always blaming everybody
and
else.
I'm never going to learn anything.
Of course, yeah. I think that's a big lesson I learned when I realized that, well, I'm here and I'm in this situation because of me. It's just my fault. It's nobody else's fault. So
what a beautiful place to be, no?
Yeah, of course. It's gratifying. It's like you wake up from a bad nightmare you're having in that time, and you realize, well, I have to start. My parents give me what they can, and so you have to continue. It's a hard lesson, but well, we got it.
That's awesome, man.
Yeah, man.
I think I mean, I'll just finish talking about, I guess, my own experiences in therapy have been just overcoming different things like that, where when I separated from my ex and I was a single dad, feeling like I was a failure of a father for not maintaining the family. I still go to therapy now, and it's more so going back to what you were saying, like, why is my family separated or fragmented? Why are there these different conflicts within the family? And it's just things that you have to sift through and understand so that you can move on with your life.
And get over it.
And get over it, yeah.
Get over it and try not to make the same mistakes your family made, because anybody's perfect.
Yeah.
There's no perfect family. There's
Exactly.
no perfect group. So you just have to learn the good things and trash the bad shit that have been affecting you. Try not to repeat that. I don't have sons, but well, I hope I do. I don't know when, but it's kind of not repeating the same mistakes your family make and getting the good things to make your own empire based on what you have learned all over your life.
Yeah.
So that's very important.
And be prepared to make mistakes either way. So it doesn't
Of
matter.
course. Mistakes are going to be everywhere. Yeah.
Oh, yes, Cesar, it's been a pleasure. Is there any message you want to send out before we wrap up here?
Well, I just want to say to Adrian that I'm very, very grateful to be here, man. Thanks for the invitation. It has been a great pleasure, and I'm very proud of everything you've done here, man.
Thanks,
and well, para que lo sepan, Adrián tiene AMP Mental Health acá en Miami, pero el grueso de la consulta de salud mental es online, así que desde Venezuela o de cualquier país del mundo pueden consultar en inglés, en español,
Sí.
sin ningún problema.
Muchas gracias, Cesar.
Sí.
No, it's been a pleasure to have you here. I know we talked about you coming here on the podcast, and you were like, "Hey, I'm in Miami next week." I was like, "Let's go."
Yeah.
But thank you, man. I feel like you shed some light on some things where, especially here in Miami, where plastic surgery is thought of as something so superficial.
Yeah.
And I think it's important for people to realize why people seek plastic surgery. And a lot of times it is because they're not seeking perfection. They're looking for some sort of improvement. And underneath that is just to boost their self-esteem so that they feel better. And it's not necessarily because they're trying to resolve or achieve perfection. And those people who are seeking perfection, then those are people who we should dig a little bit deeper and try to help them get past that. So I really think it's it's important for people to know that, because I think we live in a society where a lot of people like to point the finger and just judge people for going through with the surgery. In the end, it's your body, it's your choice. You should be able to do whatever you want with it.
Of course.
But on the back end, it's also the responsibility of the provider, whether you're an injector or plastic surgeon or whatever your role is, to intervene and say, hey, I realize you're seeking perfection and there might be some other things that you want to deal with before we move forward with the surgery.
Of course.
So I think both sides are very important for people to understand, is that it's okay, it's your body, it's your choice, but we want to help you either way, whatever help means.
Of course. And as health providers, we have to detect the problems that goes more deep than just something that people want to change, because sometimes change doesn't have to be physical. It have to be in your mind and in your body and your lifestyle, and we have to be like promoters of all this.
Yeah,
it's very important for you.
Absolutely.
Yeah,
thank you very much, man. I appreciate it. It's a
man.
pleasure, bro. Wrapping up, guys. Take care. And we're still live.
Yeah.
Bye, Alex.